Good afternoon and welcome to our white coat ceremony. This is both a joyous and a solemn occasion because it represents a passage from being a student to a point of being a professional. And you've been going through that passage for some time, but we think it's important to take a moment and mark that passage. But let's start on a joyous note for the moment. How many parents in the room think they are the proudest parent in the whole auditorium? Hold up your hands. Oh my goodness. Uh-oh. We have a problem. Okay, I think we have a tie. So we'll have to resolve it some other time. So this is a time when I talk for a couple minutes about things that are the same and things that are going to be different. There are some things that are the same that we talked about the very first week that we met. And one is, what do we want to characterize our students at the end of 4 years? And there are several things that we aspire to. We aspire to a basic core of knowledge, both in clinical and basic areas. We hope for technical excellence. We look for critical thinking. Half of what we teach today is going to be out of date in 5 years. We don't always know which half. We look for a good set of ethical and professional values. The trust of your patients and the trust of the public will depend on you, on those values that you hold, and people will know when you have them. Ability to manage a practice. Many of you will be in practices. Ability to function in a collegial professional setting, and social responsibility. As a profession, we need to reach out to do all we can to make sure that people have every opportunity to achieve good oral health in this society. Okay, so that's where we want to wind up. Now, how do we get there? So just to reiterate, I'm still on the things that are the same. So some things we've asked you to do is work hard, and I know, because you're here, that you have worked really hard to get to this point. And I hear from dentists all over, really good dentists, that tell me that much of their patient clientele knows the value of good oral health, and they want it, and they're willing to pay for it. And so we want you to have the skills and the talents to be able to deliver top quality care and services to your patients. So that's one. The second thing is we do admit students that every student, if you work hard and play on the team, can graduate. And so that's the second thing, is play on the team. And you will learn a lot about working with each other when you get out of here, even if you're practicing by yourselves. It will be important for you to have those kinds of connections to keep up with the rapid pace of things going on. The third thing is take care of each other. I think probably half the people sometime in their 4 years have some kind of problem. And to me, half is normal. Some people may have a family problem, they may have a health problem, there may be one course that the wheels just don't quite hit the ground just right. That's okay, and we're here to help each other out. So take care of each other. And the last thing is do your best, and do your best. Here's some things that are different now that from here on, and we're really going through a passage here, but this day marks it. The first thing is people are putting their health care in your hands. That's the first time that will happen. And there's a lot that goes on there. One is that you will have the opportunity to influence people's health. And that's a great responsibility. It's an exhilarating thing that you'll hear more about in a minute. You will also be scrutinized more closely than you have probably ever been scrutinized in your life. People are this far away, and they know what you're thinking, and they know how much you're paying attention to giving all of your attention to them now. The next thing is that it's important to treat every single person the same as you would treat a loved one. Figure out, this is one of the loved ones in my life that's with me today. This is my patient. How would I treat them? And I think if you apply that really golden rule, that will carry you a long way. The other thing is people have privacy, okay? Unlike if you talk about biochemistry or something, it's good to share. But the privacy, it is important to share information about patients, but there's a way to do that and a way not to do that. So I think people's privacy, and again, would you want information that you're about to talk about to be shared with loved ones? So elevator talk, cafeteria talk, that's pretty much a thing of the past when you enter this. Another thing you'll find out is working with a terrific staff that we have. We have over 250 people, staff at the college. Half have been here more than 20 years, and 80-some have been here at least 20 years. They're terrific people. They love you, and they want to take care of you. And it's a great lesson to learn when you get out. You will want to take care of your staff. The other thing you're going to be doing for the first time is irreversible procedures with the public. So that's something that, and we'll be there. We'll be right there all the time to help you with that, and faculty will make sure you're ready to do the next irreversible procedure. So that's a list. I think you'll find that the patients you're about to deal with are both loyal and possessive. I think you'll find that people from around here look at this. This is their dental school. This is their university, and if you hadn't noticed, these are their Hawkeyes. So they're going to feel very possessive, and they're going to be loyal. We have people who have been coming to our college, for 50 years, and so I think you'll really enjoy these people. You will give them a lot. They'll give you a lot. And I think to close, this is just such a fulfilling profession for all the reasons that we just talked about. So with that, let's get on with our white coat ceremony. So to get things started, we have Pete Damiano. Pete is director of the Public Policy Center, is nationally and internationally known for his really groundbreaking work, and we're really honored to have him as a professor at the College of Dentistry. Professor Damiano, thank you.
Thank you. Good evening, everyone. Unlike Monday, no singing tonight for those of you that were at the talent show, but there was some really good talent among the D1s. You got to keep that up for the next 3 years, show off those other classes. As Dr. Johnson was just talking about, this really is a groundbreaking and big change for all of you. Many of you had some sense of what it was like to go into dentistry and be a dentist. Some of you probably not so much. The usual reasons that people go into dentistry are what? Things like, I wanted to use my hands, right? I wanted to help people, and I want to do something in healthcare, I want to be my own boss. That pretty much sums up many of you, right? But once you get here, all of a sudden you actually realize, what does it mean? And I remember sitting there after my sophomore year down on the first floor link, and had a friend of mine's dad who came over, was a dentist up in Dubuque, and he goes, if you knew what it meant to be a dentist, when you started, would you still have gone in? And we all kind of looked at each other, and at that point, you're not doing the fun stuff yet, right? And you're kind of like, well, I don't know. Now you're getting to do the fun stuff. And now you're actually going to be doing the things the reasons that you came and wanted to be a dentist in the first place. Now you're going to be helping people. Now you're not just going to be working, in a lab and doing something, which is important, and all those kinds of things, which is great. But at the same time, now you're actually be doing this to help people and change their lives. And that's something that's really critically important. And according to the American College of Dentists, which is one of the reasons that we started this white coat ceremony a number of years ago, that this white coat ceremony is supposed to signify the transition from preclinical instruction to clinical instruction. And at most schools, this is done after the second year. But one of the things that I think makes Iowa unique among dental schools is that you actually start seeing patients in your summer, and you start seeing real patients, right? Even if they're a classmate or something like that, or a family member, those are still real patients. If you're the one in the chair, you want to be thought of as a real patient. Those are real patients. And so that's one of the things that makes Iowa unique, and one of the reasons this ceremony is really important, because you're making that transition from preclinical to clinical, and you're actually going to be doing these things on patients. And this kind of responsibility is something that goes beyond yourself as an individual and that patient as well. And that's one of the things that's very significant, and I think that you'll be learning all the way through here at Iowa. At this early part, you're in the lab, and we're talking about line angles and point angles, and getting your loops out and looking at all these microscopic little things, and looking for micro leakages if you could see it, and all those kinds of things, which is again really important. But now you've got to understand so that, that line angle, point angle is a part of a tooth, which is a part of a mouth, which is a part of a person, and that person's a part of a community, and that's a community that you're going to be entering and be a part of. And that's the thing that really makes you special. And Dr. Johnson was talking about that differential knowledge that you're going to be getting, and that continues all throughout your career. So the more you know you don't know, which is one of those things that as you move along right now, you kind of think, hey, I know what I'm doing. And then all of a sudden in a year, you're going to realize I didn't have a clue what I was doing. And that's a good thing, right? You're going to start learning more things. But as you do that, that level of knowledge between you and your patients is also going to grow. And with that, the responsibility for you to look out for the interests of your patients also becomes greater, because they don't know. You know a lot more than they do even now, even though it doesn't seem like it. And you're going to continue that process. And so the responsibility and the ethical responsibility that goes with that continues to grow as well. And that can be a little scary, but it actually should be something that you should feel really good about. And that you're going to be able to provide these people with care in a way that you're going to be able to see benefits, and they'll see benefits from. But there's also a component of this is sort of like for those of us as teachers or instructors, that we often don't know when we've affected a student. And we don't know, occasionally you'll have a student that'll come back and will say, hey, it was really important when you did this, or really appreciate you do that. Most of the time, everybody's going on with their lives, and that's kind of what it is. And it's sort of the same thing with patients. Many of these patients, you're not going to necessarily know what kind of an impact that you have had. Some of them you will. The real phobic patients, and I see quite a few phobic patients in our faculty general practice, and Ms. Cunningham and I have cared for patients for a couple of years. And, you have this group of patients that they'll come in and they're really scared, and then they'll, say, this was, great, and they'll come back. And when they come back, that's a good thing. When they don't come back, you don't always know why, but that's okay. But you'll see that impact on some. But there's a lot of other patients, you're never going to know what kind of an impact that you had, but you could have a really positive impact on those patients in a way that's really important. And there's some of them, we see a lot of special needs patients and a lot of special needs adults. And those are patients that you would think have so many things going on in their life that dentistry just isn't that important. And often, I think in dentistry, we put ourselves down and, we don't deal with life and death things, and, it's just a tooth, and it's not that big a deal, so, what I do is not that important. But the longer you're doing this, the more you're going to see that kind of impact that you do have. You've got a cancer patient or a patient with MS or something like that you really think, why do they care about their teeth? That, they've got all these bigger things going on, and you're going to realize, no, their oral health is a visible marker of their total health. So if their teeth are starting to go for one reason or another, all of a sudden it indicates to them that other aspects of their health status are also going. And so that's a role that becomes really important. And this is not a cut down to any of our medical colleagues, but often I think, dentistry is teeth, and medicines, they deal with people's life and death. You think of what a primary care provider does on the medical side on a day-to-day basis, and they're not dealing with life and death. They're dealing with people with chronic illnesses and people with a lot of the things that are going to get better whether they saw them or not. Almost everything that we see in terms of the treatment side are for things that are only going to continue to get worse unless we intervene. And so both on the medical side and the dental side, we're dealing with a lot of chronic illnesses and a lot of things that affect people's quality of life. And that's a really important thing for all of us to kind of keep in mind as we're thinking about how we're going to treat those patients. Treating them like your family, treating them like they're a loved one, treating them like the way you want to be treated is obviously something that you want to keep in mind as you're going through all of those things. And so this is a really exciting moment, and it is one of those things that you want to take seriously. And it'll take a little bit of time to really internalize what that means. But the more that you do that, and we were just talking when we were on stage earlier, the more that you really think about how you're going to treatment plan patients and what do they really need and what am I doing that's in their best interest, and where you get the self-fulfillment out of being a healthcare provider. You're going to do fine financially. You're going to be in the top 1% of people in the world, even though it doesn't feel like it now. You're coming out with all this debt and you're wondering, how am I ever going to make it, and all those kinds of things. But you'll be fine, and you'll get to that point. You got to be a little patient, but you'll get there. But continuing to think about what is in my patient's best interest, and parents, don't worry, they'll be fine. They'll get there. I came out with a significant amount of debt back a couple of years ago. It takes a while to pay that all off, but it all works out. And so, really kind of relish this moment, internalize this. Your life is not the same, but that's a really good thing. This is a really positive thing. You've got a lot of people that are supporting you. You're going to go out into practice. You'll have a lot of people that are supporting you, as Dr. Johnson was talking about, your staff, your patients, your community, all those kinds of things. So enjoy it, relish it, embrace it, and really think about the ethics that's really involved with all this. So thank you.
I'd like to take a moment to introduce your next speakers, so I'm going to introduce all four of them at once. Dr. Alberto Gasparoni is representing the International College of Dentists, and he's a professor in our clinic administration area. Dr. Daniel Kegler is representing the American College of Dentists. He's a 1975 graduate and practices in Independence. Dr. Adam Fuller is representing the Pierre Fauchard Academy. He's a 2003 graduate, and he practices in Des Moines. Professor Marcia Cunningham Ford is our Omicron Kappa Upsilon president, and she is a professor in the Department of Preventive and Community Dentistry.
Thank you. First of all, I want to address all of you. I have to say it's a great pleasure and honor for me to be here today. First of all, I want to congratulate all of you for your accomplishment and for your beginning as clinicians. For many years, I had the honors and reward of treating patients, relieving pain or restoring smiling, chewing, and eventually comfort in patients' life. And this one, I have to say, has been one of the biggest blessings in my life. At the beginning of my first career as a private dentist in Italy, all I wanted was to be able to give the highest service to my patients, whether they were private practice patients on self-pay or patients seen at a community healthcare location. Later on, I realized that helping others who could not afford the treatment was also a great privilege for me, and I have enjoyed to treat them and interact with those less fortunate patients since then. After several years of practice as a dentist in Iowa at the College of Dentistry, I can say that I still have the biggest honor and rewards to treat patients and helping them to achieve what they want. Better smile, better chewing, improving their social comfort. As director of the Admissions and Emergency Clinic at the college, this is still one part of my job, daily job, and I still enjoy every single day. Now, while I'm here today, on behalf of Dr. Rick Williamson, who is the regent of District 10 of the International College of Dentists, who couldn't be here today, I will talk a little bit about the International College of Dentists, which is one of the oldest and largest international honor society for dentists in the world. The International College will celebrate its 100 years of existence in 2 years, in 2020. About 6,400 members of the International College of Dentists live in the United States. About as many live outside the United States in the world. Why this association is important? Because it shares 3 core values, which are also very important, as you will find out, as you have heard already from Dean Johnson and Professor Damiano today, which are very important in the College of Dentistry. And those values are integrity, service, and leadership. Integrity, I'm going to pretty much to tell you, to read you what I found in the website of the International College of Dentists, but I feel it's very appropriate. Regarding integrity, the important message to each one, to each practitioner, is the profession and your colleagues are watching. Even if they are not now, they will. So keep your bar and standards as high as you can. You don't want someone else to do it for you. Leadership. The International College of Dentists has a primary goal to recognize and promote leadership in members of the dental profession. Dental leaders manifest their talent through service to fellow dentists, members of their civic and religious communities, and even to all of mankind. And again, this one is from the webpage of the International College of Dentists. Service, I'm going to read again. The purpose of the United States Section Foundation of the International College of Dentists is to advance the art and science of dentistry by providing a means for dentists and other interested parties to share knowledge, skills, and resources, whenever and wherever the need may arise, and to support the missions and charities around the world. I'm going to close here, so I will be on time. My last remark is that when we consider our profession, we always should keep our values, integrity, being leaders in our community, and giving back to the less fortunate when we receive what we receive every day by our patients. Thank you for your attention.
Thank you, Alberto. I'd like to start off by congratulating everyone here tonight, not only the students, but the parents, the friends, and the relatives that are here who probably played no small role in the events that are happening this evening. So I hope you have a great weekend and a wonderful evening. My name is Dan Kegler. I'm a past president of the Iowa Dental Association and chair of the Iowa section of the American College of Dentists, one of the sponsors of this evening's white coat ceremony. I am a graduate of the College of Dentistry, and as Penny said, I practice in independence in a group setting with my son and a partner of 30-plus years. And we are all very proudly Iowa graduates. The white coat you are about to receive this evening is symbolic of your transition into patient care and clinical practice. It is a visible sign that you're moving forward in your quest to becoming a dental professional. Dentistry is a multidimensional profession which will allow you to express your creativity in many different ways. It will call upon you for critical thinking and sometimes difficult judgments. As you begin working with patients, you will often find that some have different values than you. Try to empathize with their needs. The patient's interests must always come first, while maintaining a reasonable, ethical, and moral standard of care. When you show patients you care, you will gain their trust, respect, and eventually their loyalty. How good you become in developing your skills and judgment in the ever-evolving clinical practice of dentistry will depend upon you. And as Dr. Damiano said, a simple question I have asked myself over the years is, would I want this treatment for myself or my family? If you are honest with yourself, you will always do the right thing for your patient. The American College has provided each of you with an ethics handbook for dentists and a card with the ACD tests for ethical decisions. This will be an excellent guide for you as you proceed into the clinical phase of your education. Use it to help you in the difficult situations. Always know your limits, and remember, in the end, what you really want is what is best for the patient. In closing, you have a tremendous academic environment here at the University of Iowa and the College of Dentistry. You have access to a world-class faculty and an opportunity to graduate from one of the best dental schools in the nation. Take advantage of the knowledge of your instructors to help guide you through the tough times. Don't ever be afraid to ask them or use them, as more often than not, they will have a shared clinical experience. And when you finish your formal education, whether you go into private practice, a group practice, a residency program, corporate dentistry, or even the military, always remember to serve your patients to the best of your ability, both clinically and ethically. Use the foundation you receive at the College of Dentistry to find your vision of the future. Set goals for yourself that are attainable and move towards them. Prepare yourself to make the right decisions every day in the treatment of your patients. And finally, as you progress through your careers, I encourage you to become involved in professional organizations. I can tell you from my heart, you will gain so much more than you give when you are involved. I want to thank you for your time, and again, congratulations on receiving your white coat this evening.
Good evening. I had all these notes prepared, but everybody kind of took everything I was going to say and already talked about it. So I won't keep rehashing what's already been said, but you can kind of get the theme of ethics and integrity. That's what the Pierre Fauchard Academy also stands for. I'm a member and a section chair of that academy. You guys are starting your career now. You're getting into more clinical realms of what you're going to be doing. You know, you used to sit in the sim clinic with your earbuds in, working on a mannequin. They can't talk to you. You don't talk to them, or maybe your classmates might think you're a little crazy. But now you get to go to the clinic and sit for a 4-hour appointment with a patient who can talk to you, or can't, with the rubber dam on probably, but you're gonna have to make conversation with them for 4 hours. So work on your communication skills, that's important. Be comfortable with yourself and how to talk to people. Be interested in what they're interested in. You'll learn as you go that you become competent in a lot of different categories. And patients have views, you have views. You kind of have to be in the middle and just keep your views kind of in the middle. Because you can get onto a debate. I always encourage you not to debate politics. That's a real bad one. Just stay out of it, because you'll offend somebody probably. But again, ethics is very important. Each year I practice, I've been doing this now for 15 years, and each year I see more and more ethical issues coming up, which really makes me sad for our profession. So it's up to you guys, the new class coming through, to bring that bar up and raise it and maintain the ethics, whether I see clinicians taking out silver fillings just to do it, no reason at all, or treatment planning way too much. These are some of the things that we see on a daily basis. So don't fall into those categories. You're gonna have lots of expenses. Not every day you're gonna be profitable. Some days you're gonna win, some days you're not. But it's up to you to maintain the ethical standards of dentistry and our profession, because we are one of the most trusted professions in the world, really. Sometimes we're even more trusted than clergy. So remember that, because you're there to be their counselor, shrink, dentist, care provider, friend, you name it, we're there. And unlike any other profession, they trust you more, and they seek your advice, so understand that. But the change has got to start with your class, so I encourage you all to be champions for our profession. In closing, I'm going to probably break rules. I don't care. But I'm going to give you a quote from Luke. It's very pertinent, and it says, "From everyone who has been given much, much will be demanded, and from the one who has been entrusted with much, much more will be asked. Thank you, and go Hawks.
I'm Marcia Cunningham Ford, and I'm faculty in the Department of Preventive and Community Dentistry. My role here today is twofold. I'm the president of the Mu chapter of Omicron Kappa Upsilon, and I would like to give you a brief overview of this group. Omicron Kappa Upsilon is one of the sponsors of this event tonight, along with my esteemed colleagues, and we are lucky to be in this beautiful facility and glad to have all of you here with us tonight. Omicron Kappa Epsilon had its inception with the class of 1914 at Northwestern University Dental School. A committee from this group submitted a petition to the faculty of the school, which stated that they were desirous of organizing and funding a national honor fraternity similar to other honorary fraternities now existing in leading universities, but which shall consist of dental students exclusively. Admission and membership to which shall be based on scholarship and character as manifested by election of the faculty. Omicron Kappa Upsilon was to have a standard for its membership, certain ideals which are found in the preamble of its first constitution. It reads, to encourage and develop a spirit of emulation among students in dentistry, and to recognize in an appropriate manner those who shall distinguish themselves by a high grade of scholarship. I would briefly like to impress upon you that we are expecting of you much more than just minimum standards. The values that we stand for remind us of what it takes to complete this training and to accomplish our goals. They inspire us to do our very best at all times. Members are inducted into OKU are scholastic standouts with unblemished moral and ethical character, and that's always the goal to strive for. The University of Iowa established its component chapter, the Mu chapter, in 1923 with a long and rich heritage. From myself personally and from the members of OKU, congratulations on receiving your clinical privileges and your white coat this evening. You should be very proud. My other role here is that I am the course director of the course where we get to see patients in our first year of dental school here. And you might have heard some stories from your, we call them our students, but your son or daughter, sibling, friend. And our students might have told you a little bit about what we've been doing in this first year they've spent with us. We've been seeing each other as patients since January. And with that, we're now ready to move on to see patients who aren't our classmates. And so this is our transition for our clinical privileges to see the patients of the College of Dentistry. And some of you I know are going to be our patients here in the next week or two, a couple weeks, and we appreciate that. And maybe you're coming a long way to do that, and I hope that our student has told you that you will be here all afternoon. And because, not that we aren't working really hard, but it takes that long to get this accomplished for right now. But I do want to assure you that they are going to get faster at this, and they can actually make a living at this dentistry thing. Pay off those bills. So in that role, upon the recommendation of the faculty, Dean Johnson, I would like to request that these students be given clinical privileges to see the patients of record of the College of Dentistry. Granted. Thank you. They've worked hard to get to this point. Congratulations, you have earned this. A little bit about logistics, and so I will, in a few minutes, be directing the students to come up toward the stage, and they're going to make their way up that row, back and around this ramp, to come over here to get their white coat placed on, and Dr. Damiano will be doing that for us today. Then you'll proceed across the stage to see Dean Johnson, and he will hand you your certificate here and shake hands and stop long enough to get a photograph here on the stage. And then the students will continue down this way and back to their seats. Okay, so that's how it's going to go at this point. So I'm going to ask the first two rows to rise, please, and come to the stage. Zachary Brown. Okay. Kellen Bohn. Jensen Braun. Zachary Brown. William Burns. Jasmine Butler. Kara Cahalan. Aleandria Cashmore. Marissa Cody. Connor Dang. Kacie Dillow. Callie Disterhoft. Aminata Dumbuya. Kyle Dunne. Seth Dunne. Sean Engel. Brandon Inlow. Kayla Erps. William Fletcher. Kirby Fuerst. Katherine Giles. Cody Glass. Cameron Gray. Riley Gray. Timothy Grabinas. Kyle Hageman. Ryan Hemsley. Rachel Hoffman. Jameson Hook. Jacquelyn Hughes. Benjamin Jacobson. Dylan James. William Jung. Erin Kallsen. Yusung Sunny Kang. Eric Kinney. Brendan Kunlo. Hannah Klassen. Lauren Lang. Carolyn Leroy. Morgan Lauer. Grant Lehman. Jared Loftus. Colton Maharry. Taylor Majerus. Christopher Marshall. Alec Mathews. Alexis McGinley. Amanda Miller. Amber Mills. Olivia Mitchell. Nicholas Niemers. Lina Nguyen. Stephen Oki. Allyson Orwig. Paige Peters. Nathan Peterson. Lena Poonnopatam. Macy Pribble. Zachary Prouty. Turner Reed. Victoria Ridout. Jordan Rosehart. Andrew Scheidemann. Courney Schulte-Wikan. Stephen Sinnett. Elizabeth Skotowski. Kassie Sopher. Michael Stark. Taylor Steffens. Kelley Trimble. Alexander Van Gerpen. Travis Van Roekel. Katherine VanFosson. Briar Voy. Chase Wiedemeyer. Suya Nguyen. Trystan Wiedow. Rick Young. Would the class please stand? Dr. Damiano is going to, you need to open your folder there. Dr. Damiano is going to lead us in the oath of a dentist.
So where the blank is, you say your name, just so that that's clear. So, I, Pete Damiano, as a member of the dental profession, shall keep this pledge and these stipulations. I understand and accept that my primary responsibility is to my patients, and I shall dedicate myself to render to the best of my ability the highest standard of oral health care and to maintain a relationship of respect and confidence. Therefore, let all come to me safe in the knowledge that their total health and well-being are my first considerations. I shall accept the responsibility that, as a professional, my competence rests on continuing the attainment of knowledge and skill in the arts and sciences of dentistry. I acknowledge my obligation to support and sustain the honor and integrity of the profession, and to conduct myself in all endeavors such that I shall merit the respect of patients, colleagues, and my community. I further commit myself to the betterment of my community for the betterment of all society. I shall faithfully observe the principles of ethics and code of professional conduct set forth by the profession. All this I pledge with pride in my commitment to the profession and to the public it serves. Congratulations.
We're going to take a group photo of the class out on the steps in the lobby. And so if we would, the students would rise and go to those steps, and the family would wait until they get there, and then we'll join you.